Hello, my name is Destin Whipple. I am one of the optometrists with VOSH, Arizona. And I hope you are getting excited like I am to join everybody in Mexico for our upcoming trip this spring in Hermosillo. This is just a general overview video, and there's going to be a few other videos on some of the more specific areas within our clinic. And so please look for those after this video. But first of all, I just wanted to thank everybody for coming. And who will you maybe meet on this trip? We have a lot of optometrists involved, opticians, sometimes ophthalmologists. We have optometry students. All of these folks come from both Mexico and United States to meet on this trip. There is also plenty of volunteers that are not associated with eye care, which I think is very remarkable, and I'm grateful for each of their contributions. Many of them really make tremendous contributions for what we do. I want to show you my little pin here that I got on one of my first trips with VOSH, Arizona, down to Mexico. I love how it shows the Mexico and United States flag together. To me, it really symbolizes that we're coming together to do good. And we do really a lot of good on these trips, which I'm so grateful for. So the other thing I want to just tell you right now is we have two main goals with VOSH and this trip to Hermosillo. Number one is we want to help as many people as we can. We want to give out as many prescription eyeglasses, over-the-counter readers, sunglasses, and educate people to make them more healthy as we possibly can. The second goal is we want to educate and improve our upcoming optometrists who are in school right now. This is a great opportunity to get so much good experience in our clinic here. And so we have a big emphasis on education for our optometry students in Mexico and the United States. So with that, let's go through the clinic together. I'm going to do this as like you're a patient coming through, and which station you'll likely encounter first, and going through one by one. So the first station we usually call registration. This is where volunteers will help each person sign in and gather very important information. I want to show you an exam form that we will likely use. And this is the color-coded version that shows where each station will likely document. The blue area is for registration. If you look closely, there's a lot of check boxes. So that helps go through and get the information quickly. Also, I want to point out here, this box here is talking about what the person's wearing as far as glasses, or what they usually wear. And this is very important. This is a great place in registration to ask the person to get their glasses out or have them ready so that we can measure their prescription. Down here in notes, I indicated a spot we call lensometry. On this form, there's not an actual spot to record what their current glasses prescription is. So this is likely where we will put it. We have a machine that will let us measure each person's prescription for those folks that already have glasses. After patient registration, we have our station number 2, which is patient education. In the United States and Mexico, both of our countries, we have a lot of problems with diabetes and high blood pressure and many other conditions. And so these are some conditions that we will highlight usually in our patient education. There's usually a very good presentation, sometimes even a video involved there for each person to be able to learn more about their health and what they can do to improve it. After patient education number 2, we come to our visual acuity station number 3. This is where we'll document in the green area here, and this is essentially measuring their current vision. We usually do this through glasses that they would wear to drive, and then also it's important to get their pinhole visual acuity as well. Please look to the extra video on visual acuity. That's a very important station. After visual acuity, We'll move on to autorefraction number 4. This is the purple area here. At autorefraction, we use a machine that will get an estimate of the patient's glasses prescription, which we will use later on to fine-tune their glasses prescription. For both autorefraction, visual acuity, and actually patient education and registration, these are all handily done by any of our volunteers with a little bit of training on some of them. After autorefraction, we move on to number 5, which is triage. This is a station kind of in the middle of the patient flow that we added several years ago. Optometrists and optometry students, maybe ophthalmologists, will serve in this station, and the purpose is to expedite our patient flow. Sometimes at this point, we can tell that certain patients may not need to go to every station, and so we may have them skip a couple stations. Look for the extra video on triage for more on that. This is the area we will likely document in the yellow for triage. After triage, we move to number 6. Station number 6 is refraction. The pink area here, this is where we measure the patient's prescription and help them make sure we're getting the type of prescription that's going to be best for their visual needs. After refraction, refraction is also usually served there by optometrists and optometry students. Next is number 7, ocular disease, which again we'll use the yellow area primarily to document. Ocular disease is where we're examining the patient's eye health. We use slit lamps, we use various ophthalmoscopes and other specialized instrumentation to really get a thorough examination of their eye health. We may also make recommendations or referrals for perhaps surgeries or other procedures that may be necessary for each individual patient. After ocular disease, we come to our last station, number 8, which is the optical or dispensing area. That's toward the bottom here where we'll document for that station. This is where opticians and optometrists or optometry students will measure pupillary distance, seg heights, help make sure people are selecting frames that are appropriate for their face and head. And this is also where we will dispense non-prescription reading glasses or non-prescription sunglasses. We want everyone to at least come away with sunglasses to protect their eyes from the UV exposure. I think this is a pretty good overview of the clinic. I thank you for watching, and please look forward to the next more specific videos. We have some on visual acuity, refraction, triage, and ocular health.